Hello and welcome to this class, which is all about how we can work one-to-one with somebody who has back pain with or without sciatica. So that means leg involvement. So sciatica generally is a layman's term. It's not so much of a medical term, but we all use it because it means that they've got some kind of pain in the leg, down the leg, even as far as the foot. That could also include pins and needles or in very extreme cases, loss of function. So loss of function is where you've had pain or no pain sometimes, and there's something not right in your back or in your glute, your buttock. And then over time, you've noticed that that foot doesn't seem to work. That is really the end of the spectrum. That means we've got a major problem. So if you know somebody who has that problem, send them straight to the doctors so they can be assessed for that. So we're looking at helping somebody one-to-one if they have had some back pain, some gluteal pain, with or without pain in the leg or sciatic symptoms. So the first thing we need to do is think about how we can address this in a way that won't cause any more fear. So the fear and the prediction of how things might go is the biggest issue for most people. So when their back hurts, we all have been in this situation, you immediately start thinking, oh my goodness, I won't be able to go to thing next week. I won't be able to pick the grandchildren up. I won't be able to go to work. And it can cascade a little bit. We are definitely in a period of time in our society where we make a big deal of our pain and we let it get to us, maybe a little bit more than we would have done 100 years ago when people used to get on with it a little bit more. I don't think we should go back to being like that, but I think we should do a bit of a reality check now on what pain means and what the best course of action is in most cases, up to 99% of cases of back pain. So pain is this complicated topic, and you might have seen some of my videos on pain. Pain is one of our most brilliant defense mechanisms. It's a mechanism that goes out. So it's telling you that the brain's telling you that I've had some information come in. It might be from the area. It could also be from other areas of the brain. It could be from a memory or, a trigger. Something's triggered from seeing something, and that's cascaded into this information overload to the brain or parts of the brain that make decisions on danger. So the first thing to note about pain, especially when it comes to back pain, because it's the most common, like 100% of adults will get it, is pain is sometimes a warning. It's not always telling you that there's damage. There are thousands of examples where somebody had excruciating bad back pain and they stopped work, and then they went to the doctor and the doctor sent them for a scan, and the scan shows nothing. So it might be an MRI, which really does show all of the soft tissues and the bony parts, and it shows nothing. And so that person's left feeling like, what the heck? Because I cannot move, it's very stiff. This person probably has a problem of the central nervous system. So that's the brain, spinal cord, the headquarters, decided that there is a danger, and it's made it's reacted to that danger with pain, stiffness, swelling. We can even see that. Even when we don't really find an injury, we can still see swelling sometimes, inflammation. And it's decided that that area wasn't safe. So it's given that person the message that it's unsafe. Can we just slow you down for a minute? I'm going to give you some pain. And then it's gone on and on and on. So that may have happened to that person because they worried about it. They couldn't get a doctor's appointment. They didn't know what to do with it. It was really sore. And then, of course, the behaviors changed. They stopped moving, they stopped working, and that can lead to more problems actually. So whilst in the beginning, and it's always a short-term thing, it's really good for the brain to tell you to slow down when it hurts. And when you have students that are in pain, definitely tell them to slow down. However, this phenomenon happens a lot nowadays where when that short period of time passes, people tend to still override the messages that it's safe and say, no, I don't think it's safe because my friend lost his job or couldn't get married or whatever it might be because they had pain. So, I don't want surgery. Fear, fear, fear. So, number one is to really be sensitive with our language around pain in the back. So 99% or 97 or 99% of back pain cases are benign. That means they're not caused by serious pathology. Some people, the very small 1 to 3% of people, they will have some of the more serious pathologies or diseases or illnesses that are causing that pain in the back. And those might be cancer of the bone, usually a secondary cancer. That means it's come from somewhere else and now it's in the bone, and that can cause back pain. It might be an actual prolapse disc. So the disc material has migrated outside of its normal borders and it's pressing on something. You're probably going to get those physical symptoms and signs in the leg at that point, probably, but not always. Osteoporosis, where there's actually a density problem. The bone is not strong and dense enough, and maybe it's fractured, so fracture is in there. And there are some other inflammatory conditions that affect the spine, like ankylosing spondylitis. It's an inflammatory disease. Usually affects, there's always like a bracket of people that get this more than others, and it's usually young men in their teens or early 20s, but not limited to. Then there's a few other things. There's more than that's not an exhaustive list, but that's the 3%. You will always find that there's red flags that should be present. Not always. It's very easy to miss these things, and nobody has that magic 8 ball when it comes to finding out who the 3% are. But usually the pain behaves in a certain way. So it's more unrelenting. So it's really constant. And when I ask patients in clinic, is it hurting all the time? 9 out of 10 people say yes. And then I say, okay, so when you go to bed, it keeps you up. It's there at 2 in the morning, 3 in the morning, 9 in the morning, 10 in the morning. It's there at breakfast. It's there at lunch. It's there in the shower. It's there when you're dropping the kids off. They say, oh, no, it isn't. And then it goes down to like not even 1 out of 10 actually have that. So the constant pain is on its own not enough to panic, but it is one of those things we're looking for. We're looking for loss of bladder and bowel control. That's because when the reason for that dysfunctional pain is coming from a compression of the spinal cord where maybe one of the discs have prolapsed, it can actually cut off the supply to the bladder and the bowels. Extremely rare, but usually in an osteo or a physio career of say 40 years, people see 1 or 2 of them or 3 or 4 of them maximum. That's a medical emergency. And if somebody has got loss of function to bladder, bowels, or they can't feel the skin in the saddle area, it's called cauda equina, and that means horse's tail, because the spinal cord, which ends at about the level of L1, L2, it actually ends there. And so the rest of the little nerves coming out that are still central here in the middle, they're actually peripheral nervous system. They're no longer spinal cord. So that looks like a horse's tail. That's why it's called that. So that is one of the red flags. So loss of feeling, bowel and bladder function. So can't go to the loo, haven't been to the loo. I've had loads of water, but I haven't needed the loo. That is a medical life-threatening emergency. Again, very, very rare. Weight loss, unexplained weight loss, a feeling of malaise, which means I don't feel right. I've had this back pain, it's hurting at night. I'm losing weight without really. These are all kind of late stage red flags for things like cancer and that kind of thing. So somebody comes to you and they say, oh, I picked a fork out of the dishwasher and oh, my back just went. They are going to be sitting in the 97 to 99% of back pain cases that are not serious. But it's not really, as a yoga teacher, it definitely isn't your job to diagnose and to triage that. But you should just feel a little bit put like at ease about the fact that most back pain cases are not serious. It's good to know the red flags because then you can be a triage as well and say, oh, I don't really like the sound of that. but we're not there to diagnose. So they come in, their back has gone, they've come in for their regular slow flow. So they're going to stand on the mat in Tadasana and they're ready for the practice. You know, you ask them to roll the shoulders maybe up and down or back and forth, getting them to do some pelvic tilts, and they look a little bit worried. So going back to my first point about not necessarily making people feel too fragile, it's a delicate situation. You've got somebody in front of you that is a little bit afraid to move, and you're not 100% sure that it's not a serious back pain. So why don't we just imagine for a moment that your student has actually gone to the doctors, physios, osteos, and they've done the checks and they've sent them back to say, actually, we think it's just, one of the non-specific low back pain presentations that are not serious. Quick side note on that, the red flag types of back pain can actually hurt less than the 97% who are like on the floor, so much pain. People say it's the worst thing. People compare it to childbirth. I must say that's happened a few times. So we're not saying it doesn't hurt. We're just saying it's not serious. So they've come to you, they've been to the doctor. We know that they're okay to move. So that's a big statement, because in previous decades, we taught and learnt as yoga teachers, even as physios and osteos, that depending on the type of back pain, certain angles and movements should not be performed. To be honest, that's now been myth busted and that's been researched heavily. And we now know that we need to look at people individually and find out within their pain-free range, or a limited amount of pain, say up to a 3 out of 10, 4 out of 10. So we don't want to provoke the big pain, but we need to find out what movement really suits them. So across the board, whether they have a little bit of leg pain, whether they have just that sharp pain on certain movements, we want to start with one simple thing. And that is, how are you breathing? And how are you reacting to the pain in terms of muscle tension? So let's say we're in Tadasana and we've got this as a one-to-one, so we have time. Maybe we get them to stand for a moment and even put their hands on the part of the back that hurts. And then what we can do is get them to start just breathing into the diaphragm, the side ribs, the back ribs. Maybe as the teacher, you're coming around and you're holding the back of the ribs and you're saying, breathe into here through the nose and breathe out. And then you come round the front and you put your hands either on the shoulders or maybe even to the diaphragm at the front with consent. And you're saying, breathe into here. Maybe they bring their own hand, one to the front and one to the back where the pain is, and you get them to breathe in and out a few times. So not only does this physically change some of the muscles that we're using around the core complex, this canister here, it's going to slow the system down and maybe bring them a tiny little bit out of that fight or flight response and into rest and digest. So sympathetic nervous system into parasympathetic nervous system. When we're in the parasympathetic nervous system, we're going to be in less pain, we're going to feel less threatened, and the danger reduces. If we say to the person, oh, that looks awful, please don't bend forwards, and be really careful, okay? If anything happens, just stop. We can quit, we can finish, really just hold yourself. That is going to push them up into that sympathetic fight or flight, and they're going to feel more pain. The most interesting thing about the human brain and body is that what's really happening in reality, we don't really know, because our amazing brains are constantly creating reality based on what we think is happening, which is why you can affect this so much, either on that side, make them feel scared, or on this side and make them feel relaxed. And this will help a lot. So just breathing. And when I've had patients come into the clinic who are like, I am off work, I can't sleep, nothing is helping, no painkillers. You can see the panic in their face and in their voice. I will still get them to stand and breathe. They might sit and breathe if it's really bad. I'm going to get them to lean into a position that feels good. So leaning into a position that feels good is called an antalgic posture. It means that you're moving away from an injury. So when you lean away and you see people coming into the clinic, if you've ever seen somebody with bad back pain, and they come in, hiya, love, oh, you've got to help me with this. And you see them leaning over. And then a lot of the time, most of the time, there's a good reason for the leaning away. The body's leaning away from the thing that's hurting. It could be an indication that there's a physical injury going on that side. So if I'm leaning this way, it's probably on that side there. So if I'm leaning to the right, it's on the left. And so yeah, so they come in and I still get them to breathe, because when somebody is in pain, they're definitely going to be leaning into that fight or flight response. Oh, I'm in danger. And we know that's just going to increase the threat bucket and increase the pain. So breathing. Going back to the physical side of the breathing, so when people are in pain, they tend to breathe up in the upper respiratory, with the upper respiratory muscles. Everything is guarding. So if you've got a bad injury in your arm, you're going to tense it, guard it, stop people from hurting you. So what we're doing is we're going to very gently, with the breathing, we're going to be asking this whole area to go back to center for a second, so that when we actually start moving you in a minute, your muscles are not fatigued and, ready to throw out more signals of danger, which means pain. So the physical side of it is the pelvic floor, the diaphragm, and your whole abdominal wall, including back muscles, are all working at the same time to stabilize and create just a normal everyday balance position here. And we need to maybe remind those muscles with the breathing that they are going to relax on the inhale and come back on the exhale. So maybe you'll do the first breathing exercise and then get them to bend their knees a little bit. That unlocks a little bit of that kind of scared stiffness. Unlock a little bit, and if they can, just get them to drop the shoulders, relax the jaw. So anxiety, fear, a lot of it sits in the jaw, in the buttocks, in the hip flexors, in the diaphragm. It's like ready to run. So get them to really let go of all of that. You could even say things, really helpful things right now. We know that you're going to get better. 100% of people who work on their pain or sit with their pain, or they will make some change. Although we can't promise that to everybody, and I almost want to correct what I just said. 100% of people with non-specific low back pain that is not chronic and not persistent, so chronic, 100% of those people, it will probably, in most 99.9% of cases, it will resolve without any intervention even. But that's not true and not a good thing to say if somebody has chronic pain. So this is a back pain that they've had for a long time, more than 3 months, more than 3 years, more than 30 years. Some people live with permanent chronic pain. Don't say that to them, because we can't breathe that type of pain away, unfortunately. And we can't promise them that massage or any kind of hands-on will fix it, or any kind of movement will fix it. But what we can do is totally empower them to focus on the things in their life that they do have and that do make them happy, like their hobbies, their health, healthy activities, their family, their friends, love and connection, all of the things. And that then can push that chronic pain slightly over here, still there. So I just want to make sure that I didn't tell that you don't go away from this thinking that 100% of people with back pain will get better. But we can say some useful verbal things like that. So you are relaxing, your brain is feeling safer, you're starting to feel that release, and you will most likely feel less pain once we've worked through a few more breaths. And if we don't, that's also fine. We're going to keep moving. So let me move on to the next section, which is the movements. One thing in yoga that we've been taught is if someone has back pain, don't flex them, arch them. And to be honest, that's just not true, because I could make that sound much nicer, but I might as well just get to the point. That's not true. There are as many people that find this relieving as there are people that find this relieving, as there are people that find this relieving. We used to say that based on a reductionist system of looking at, is it I just got some post, sorry, made me jump. Is it a disc? Is it arthritis? That is something I didn't mention in the beginning. Some people have a narrowing of the spinal canal due to arthritis. So we used to think that it's like this, if it's, this position is avoided, if it's this and this. It's just not the case. I watched an amazing video yesterday by one of the UK's top shoulder specialist physiotherapists working, really high up with, the top surgeons in the country. And she said, this is the tricky thing. We no longer can tell people that symptoms can point to specific injury. We used to say, if it's this test with the thumb down, empty can, oh, it's the rotator cuff supraspinatus. And if it's full can, but we were unfortunately wrong, and it's very similar in the low back. So with movement, we're going to start with getting them feeling safe. We're going to get them feeling the feet to the floor. We're going to get them maybe rocking left to right. And if you've got them for an hour, today you might just get as far as something like this. You're going to get them to maybe move other parts of the body, breathe. Remember, if we work around the area, we're giving the area a message of safety as well, like a big hug. So you might start then by just rocking a little bit, unlock the knees, get them to place a hand on the painful area, and let's rock it left to right. And then what we want to do is perhaps drop those shoulders down and start to draw the belly in, and that means that the tailbone is going down towards the floor. So that means we're posteriorly tilting the pelvis. I wouldn't say that part to a person. I'm saying that to you as a teacher. And then maybe dropping that belly forwards and allowing a little bit of backwards and forwards tilting motion. Somebody who's in quite a bit of pain, you won't get them moving much here. Also, I find the male pelvises, which are much more narrow, they don't seem to tilt very, very well, and they end up doing weird things. Yeah, I hope that was okay to say like that. It's just my own experience in clinic. And then after we do that, now we're going to think about articulating down through the spine. So when we drop the chin down, this is actually going to stretch the posterior chain. The posterior chain, according to the myofascial lines, goes from the sole of the foot, round the heel, up the calf to the hamstring, back of the thighs, all the way through the deep glutes, up the low back to the upper back, back of the head, all the way around to the eyebrows. So when we drop the chin down, we're already really adding a little bit of tension to that posterior chain. And if there's a problem in that low back, it might already trigger it. So just get them to drop the head a few times, lift the head, drop the head. Now let's talk about the breathing, because that's really, really important. So as you may have learned from other videos, but I mentioned it briefly. When we breathe in, we actually increase the pressure in the abdominal region. So the abdominal cavity is everything below the diaphragm and everything above the pelvic floor. So it's a closed bag of liquid with a stomach the stomach's underneath the diaphragm. So with the esophagus is what I was trying to say. The esophagus comes from up and in from the atmosphere. And then the anus is what lets things out. But apart from that, it's a closed bag of liquid. So when we increase the pressure, which means when the lungs want to move out the way, they say to everyone, move out the way, I want to expand. It's going to push down into this area. So when we breathe in and we let that diaphragm descend, we let the belly come out, let the back come out, the ribs come out. Remember 360, it is not just a belly breath. It is everywhere for perfect health. Then we are going to be allowing those abdominal core muscles that are maybe tense because of the pain, we're going to allow them to just release for a moment. So you can do a little bit of cueing on that. And what I would suggest is a good time to get them to move is the exhale. Put your hands out like this for me, and then let's put them together like this. Breathe in. That's what happens with the abdomen. It's expanding everywhere. It's kind of the increase of pressure is there. Exhale. everything kind of recoils and tightens again. So when someone is experiencing a loss of safety, i.e. pain, or increase of danger, it's a good idea to use the exhale. I've managed to get plenty of patients from screaming at me on the bed to getting up and being shocked that they were able to get up without any pain. Because often the body just goes into freak out mode. If you don't know what we know, the body goes into freak out mode, all gets tense. Muscles don't like contracting for longer than a few seconds at a time. And then they get fatigued and painful. So they get all these layers of pain on top of the injury because they're not breathing and they're not managing that safety. So really use the exhale. So let's start that again. So let's go inhale, head up. Dropping into that pelvic bowl, exhale. Let's let the chin come down. Now, what's going to happen if we go really slow is you're going to see this. Oh, 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 and then we're tense again. So you want to be ready for those moments because they will probably happen with somebody who's got back pain, especially the big portion of people that get the pain when they go forwards. So we want to be ready for that. We go inhale, come back up, keep moving. The sharp pain is just giving us some helpful messages about what we're doing today and what's going to help you. So exhale, go a little bit quicker, maybe a little bit further past it. Bending the knees, hands on the thighs is a good way for them to offload the low back muscles. So inhale up, and eventually, depending on, there's a massive spectrum of people here. Some people will go just head down, ow, and then you're going to get them to maybe do some other movements by stepping the feet out like this. Maybe it's just inhale up, exhale down. Some people you'll go and they'll say, oh yeah, that stretches it out. Maybe you add some inhale, twist, inhale, exhale, twist, and maybe they do some rolling up. Now you're going to be thinking, I was told, some of you have been probably through trainings where they said, always keep the flat back as you go down. And I think that was with a good intention because everything is in its context. And I think that intention and context was, we are yoga teachers. We can't push them into pain. They might hurt if they round their back. So therefore, don't do it. But if we teach somebody to keep their back straight like this, what we're actually doing is teaching them that they're not safe to do a very normal human functional movement, which is flexing here. And we know that 97 to 99% of back pain cases are not serious, and flexing forwards in 99% of those cases won't injure them anymore. In fact, what we gain from doing it in terms of creating that neural pathway, stronger pathway to say, hey, it's safe, I can do this. What that creates is a lifelong empowerment versus a sharp pain that is gone when they come back up, and definitely doesn't mean that they're going to damage themselves. We are designed to be able to do this, don't worry. You know, that is definitely where I go with all of my one-to-ones. However, if somebody goes really, keep your calm. Say, okay, no problem. We're working with your pain system right now. Your pain system is just telling us it's a little bit pissed off and it doesn't want to go there. Why don't we practice doing the opposite? So let's go back a little bit and get inhale, exhale. And I tell you now, as long as the person isn't now screaming on the floor, in which case do stop, then you've got to keep going. Keep getting them to repeat. One rule which I need to make sure that I'm communicated is, if someone has pain that's lasting pain, so you go, ow, ow, ooh, that's not a good sign to keep going. What I mean is they go and they're not sure. Remember that reality is being created in the moment, real time. So our brain is predicting everything that's happening, and pain doesn't always mean damage. In fact, those sharp, shooting, ouchy pains are quite often the alarm system. Remember that time you really hurt your elbow or your knee and it was like, ow at first, but then for 3 weeks, it was like, oh, that's really sore. That is more of a sign of something being repaired underneath. But the sharp shooting, That is, in some cases, we don't know exactly the exact percentage in your client right now, your student, but in lots of cases, it is just the warning system. So keep going. We don't want to do anything that causes lasting pain that kind of feels sore. So that's where you have to take it easy. After you've done a little bit of these movements, maybe you start changing it up a bit. Remember, it's about keeping them moving and keeping them breathing to build the feeling of safety in the brain, therefore the body. So maybe you're going to get them to bend the knees and come down. Now we're going to activate all of those beautiful supporting muscles to the low back, the glutes, the thigh muscles, and maybe they're going to inhale up, exhale down. Maybe the chin comes down. Remember that's going to stretch that posterior chain a little bit. Why don't we move them across? Maybe bring the arm out and do some movements here. You can get them to bring their hands onto their thighs. And another one that I really like, because we're just trying to bring novel, regular movements into the body, is hands on thighs. And you can get them to round the pelvis. So you're getting them to tuck and arch the back. So anterior, posterior tilt, a little bit of side shifting with the pelvis. And then see if they can come down, send the leg back straight away. Most cases of back pain, when you're down on the floor like this, should feel relieved. Remember, it's individual. So there's not just one rule for these people, one rule for those people. Work with the person in front of you. Listen, don't panic. Don't worry about a sharp pain as long as it's 2 seconds. So child's pose, keeping everything moving. So let's move on to a couple of exercises that you can incorporate into your sequencing that are quite good for back pain. So we've gone through all those other bits, and now we're kind of in this hands and knees tabletop position. Let's take the right leg back. So what I do is get people to slide the leg back, keeping the toes to the floor. So the demand is pretty low, the load is quite low, especially now that we're working through the core, through the abdominal muscles, through the back muscles. Then we can take the opposite arm forwards. It's going to add a little bit of difficulty. Get them to push through the grounded hand. And now if you lift that toe away from the floor, see if they can manage it. And then from here, we want to get them to breathe. So just because we've got more demand on the core doesn't mean you have to suck it in, pull it in, and hold it tight the whole time. You could actually allow those leggings or shorts to slightly tighten on the inhale as the diaphragm moves down. It's all about proving to the person that they're not in danger. And this is also a nice way to isometrically, which means you're going to hold that core. You're going to be holding the back muscles and the muscles in question, the glutes as well and the shoulders. All of it holds for 3-4 seconds. Rest. Keep breathing the whole way through. Never hold the breath. We're building a bit of isometric safety. It's all about the safety at this point. If somebody feels completely safe and they're really deeply feeling it in their brain, their pain will reduce. And so that is what we're dealing with. Most of the time, when we see people in pain, we're dealing with that threat bucket first. And then, of course, once you've been working with them a little while and you've gone and you've progressed this exercise up to the full bird dog. So bird dog, for example, is this one where we do a parallel leg to the floor and a parallel arm to the floor. Here we want to push the floor away with the grounded hand and hold it there. We can add things by taking leg to the side, arm to the side, tapping the knee, taking it out. All good stuff for the spine. All good for building a little bit more safety and then strength in the spine. We then might go to the side plank, which I really like. And so the bird dog and the side plank are all ones that I've given to people with acute back pain. So that means it's painful at the moment, pretty sharp, a bit worried. These are like stage 1 rehabs. And side plank, we can get them to squeeze a ball between the knees if they need a bit more stability and support. Found that helps a lot because that makes them use the adductors, which are the 4th table leg or the pelvis in the back. So there they can lift up, hold. And if they don't need the ball, that's good. You can get them to do some movements there. And then finally, the last thing I'm going to show you is the third exercise that I would give in clinic, or one-to-one, because I consider them both exactly the same. So one-to-ones are often same as rehab in clinic. So excuse my wording. So what we're going to do is lie flat on the back. I'm having a brain fart. I can't remember what we call this one. It's called the McGill crunch. So they're going to bring one knee in like this. They're going to keep the other leg like that for level 1. They're going to place, I'm going to do that the other side. They're going to place the free hand underneath the back if you can. That's just to check that they're keeping their low back pretty flat, not completely squeezed into the floor, but also we don't want them to arch up. So just keep it neutral, keep it there. And then we're going to press the tongue to the roof of the mouth. That will activate your neck flexors to make it easier to lift your head. And then from here we hold. So this is an isometric movement for the anterior side, a little bit to the sides as well. Level 2, we can take the leg up in the air, and we can be a little creative if we want to. So the legs are like levers, they're adding demand to the core, to the spinal muscles, to that stability center, and back down. And that's your McGill crunch. So that is just an idea of what I might do if I'm working with somebody one-to-one who has back pain with or without leg pain. Last thing I'm going to say today is something I meant to say earlier. Just do my hair. Why does it hurt in the back when people go forwards? There's actually a biomechanical reason why, if someone's pulled a muscle or something's pulled on the back, that we would feel pain going down. When we're standing in neutral, the deep postural muscles are switching on, but the big erector spinae, the big muscles that do most of our movements, they're not switched on. Now let's just assume that one of those erector spinae muscles is the one that's been pulled and the one that's feeling tricky. When we go into a forward fold, gravity is going to plonk me down really fast, like I'm going to fall. So what do the back muscles do to resist gravity pulling you down? They eccentrically lengthen. That means as I go forwards and gravity is pushing me down, those back muscles, which do this concentrically when they shorten, they eccentrically lengthen with the load of gravity, allowing me to go down slowly instead of going down super fast and falling to the floor. So when you have a problem in one of those muscles, it's not going to like that extreme eccentric contraction. It's going to say, ow. That doesn't mean we can't do the same things that I've taught you in this session and re-educate it and make it feel better. The conclusion here is every single person is different. Most people with back pain, it's not serious and they should move. They should keep going. They should stay at work as much as they can, because we know from the research done on real people with pain that if we leave work, if we panic about it, if we catastrophize it, if we start panicking about what it's going to do to our life, you fall into a high risk category for chronic pain. And when someone has proper central sensitization, so central nervous system is now looping on that pain, it is very difficult to ever cure it. So we don't want people there, right? So let's get in there in the beginning and let's empower lots of people to move. You can't make them worse. And I know that I've spoken to one of the Yoga Teachers Lab members about the person who says, since your class, I've had a bad back. You can't give someone a disc prolapse from them being in your class and doing a forward fold. Their body was already in that situation before when they turned up, and yoga is not a high impact, high intensity thing. You know, think about 100 kilo people doing weights and stuff. Like, it's not. We're just getting people to forward fold, do a plank, jump back into down dog. It's not that high demand. So don't give yourself a hard time if that happens. But why don't you just come back to that comment from the person who thinks it's your fault with, You know, it might be that was something was brewing underneath it. Has that ever happened before? Oh, yes, it happens once a year. All right, okay. Why don't we go through some really useful things, exercises that I know are going to help you feel less pain? How does that sound? And then you can start doing them. Don't overpromise that again, like I said before. But how about we say, why don't we do some exercises that are going to nourish that and hopefully reduce your pain? So that's the conclusion. Everybody's individual, and it's amazing to get in there and work with people with back pain because they will feel so safe around you. And you know, you can be their therapist in this moment, and you don't need a physio degree for that. I promise. Thank you, everybody, and I'll see you next time.